Buenos días, yo soy el doctor José Luis Garcia
Hello.
Galaviz.
My name is Dr. 𝐁𝐢𝐿 Garcia Galaviz. I am currently Director of Health Sciences at the Noreste University in Tampico, Mexico. The Health Sciences building has 8 floors, 2 of which are dedicated to clinical simulation. This means that we have a total floor space of 1,500 square meters, which are reserved exclusively for clinical simulation. At Noreste University, we have 5 degree courses in nursing. These are nutrition, physical therapy, rehabilitation, psychology, and nursing and medicine. There are currently around 1,500 students enrolled at the university. In addition, around a year ago, I became responsible for the Mexican National Association of Clinical Simulation Educators, also known as RENASIM in Spanish. Currently, there are more than 150 members of this society, comprising of both individuals and institutions. In addition, our association is a member of the Latin America Federation of Clinical Simulation, and we have dealings with international clinical simulation associations from all over the world, thanks to our membership of this federation. We're working very hard to ensure the continued development of clinical simulation in Mexico, and we are 100% certain that technological innovation plays a huge role in the teaching of health sciences and the education of healthcare professionals. Ultimately, our goal is to provide benefits for patients, the people under our care, and to improve healthcare and all areas of health in general. So yes, we are invested heavily in innovation. Innovations in data collection and data analysis. And this data collection is not just for our own sake. We are connected to a network of institutions who we collaborate with. This means that we have access to big data which we can collect, store and analyse. Working with this big data and applying it correctly can bring great improvements to patient care. I believe big data has transformed the way that we view healthcare today, and we want our students and teachers and the health professionals that we train to feel the benefit. Big data can improve patient diagnosis and treatment. And in medical education, it helps a lot because we record the data about work teams and students when they are taking part in a clinical simulation. We can then analyse it and give feedback to the participants in debriefings. All the data that we collect and videos that we film are analysed, compiled and made public to other institutions so that they can see the work that we are doing. Coding helps us a lot. For example, we, the Directors of Health Sciences at the university, do audits, academic audits, using data that is presented to us. For example, here in the Simulation Centre, the doctors and nurses who work there regularly make presentations about the progress our students are making. And Codimg is a great way of compiling these presentations. Seeing the performance of students in different clinical simulation scenarios helps us to understand how their learning is evolving. And it makes it easier for us as directors to analyse whether or not the academic programmes are working and if we are going to reach our milestones as set out by the School of Medicine. Codimg also makes it easy for the teachers to film and analyse a student's actions and performance. One thing I'm very happy about is that Codimg improves the team working and communication skills of the student. They can actually watch themselves in various different scenarios and assess their own performance. With accumulated videos, they can reflect and evaluate their own individual performance. as well as their performance within a team. All of this helps the teacher a lot when it comes to evaluation. The fact that Codimg allows us to create personalised digital checklists helps us to understand how a student is evolving. It also makes debriefing a lot easier, as we can have all the students' information compiled together. Sometimes it's more difficult when everything is divided up. In clinical scenarios, it can be very difficult to get the full picture of a student's performance within a group. By having the scenario filmed, it makes it much easier to be objective when it comes to evaluating the student. By using Codimg, we have a much better idea of how the student scores in an evaluation. Overall, it helps us to make a much more effective, faster debriefing, based on data that is 100% objective.